you very much, and hello again. As you already know, my name's Dan Clark, and as I've already mentioned at the start of this, I've fortunate enough to have had a long career working in the field of engineering applied to healthcare. And during that time, I've worked in many different areas. I've supported clinicians in lots of different areas around the hospital. I've worked in operating theatres. I've worked in intensive care departments. I've worked in imaging and diagnostics. I've worked in emergency medicine, in care of small children and the care of the elderly, and in all manner of other clinical applications as well. So engineering can be used in all of these areas. I'm currently the head of service for a department in a large UK hospital where we look after something like 70,000 items of medical equipment. And my role there is to support our clinical teams to make sure that through the technology that they use, our patients can get the best possible care. But as well as working in the hospital, I'm also a professor of engineering at a large UK university. And here I support the development of new technology, new ideas to use engineering to solve healthcare problems. And I've been involved in the development of a whole range of new technology, including imaging devices, including sensors to detect new diseases, technology to prevent injuries, to improve operations, to enable people to be more mobile and live more independent lives. And whether I'm working to support the existing technology, the existing equipment used in hospitals, or developing new technology, my career has always been about applying the discipline of engineering to improving health. And really, what could be more rewarding than that? So a little like Liz, I'm a bit daunted now in trying to say a few words in half an hour or so about the role of engineering in healthcare. It is just huge. And in fact, a lot of what Liz was talking about just a minute ago is very physicsy, but engineers have also supported in a lot of those technologies. So I'm going to try in the next half an hour or so just to give you a little flavour, really, of where engineering is used in healthcare. We all, I guess, recognise and value the contribution of engineering to our world. The computer, the phone that you're likely watching this presentation on now owes its design and build to engineering. The building that you're in was probably supported by the use of civil engineering expertise. Our roads, our bridges, our tunnels rely on engineering, as do our transport systems, from cars and buses to trains and planes. They're all the product of engineering. When we think of engineering, we perhaps think of skyscrapers and train stations, or maybe jets and rockets, or power stations and transmission lines and cables, huge construction projects, maybe even robotics and space exploration. And of course, these are all wonderful examples of what engineering can do. But I'd like to talk to you today about a branch of engineering which is perhaps less well known, perhaps less well appreciated, less often seen. And I know I'm biased, but I believe this branch of engineering should actually be lauded above all the rest. It has as many challenges to solve, as many hurdles to overcome, but it directs its efforts and sees the fruits of its work by making people better, improving the quality of people's lives, and keeping people healthy, and indeed, sometimes even saving lives. And this is the branch of engineering that we refer to as healthcare engineering. But, whoops, sorry. But just for the second, let's take a quick step back and ask ourselves what we mean by engineering in general. I'm not a great one for these sorts of definitions, but I looked at the definition of engineering, and the American Association for Engineers defines engineering as having three elements. The first element then of engineering is the creative application of scientific principles to design or develop structures, machines, apparatus, or processes, which is a lot of words. But it really just means, essentially, this is innovation, creating new things, new technology. So part of engineering is creating new things. The second aspect of engineering they define is to construct or operate machines, apparatus, processes with the full understanding, the full cognizance of their design. So this is essentially looking after technology, managing technology, and the appropriate use of this new technology. And then the third aspect of engineering that they define is to be able to forecast the behavior of systems and of machines, apparatus, processes, the specific conditions. So this is essentially measuring the impact, assessing the impact, the effectiveness of technology in the real world. So those then are the three areas of engineering that the American Association defined. How do we apply those in healthcare? Well, that first engineering then is about inventing stuff, designing new stuff. And this is really, really important in healthcare. There are just so many challenges facing healthcare and healthcare workers, and there always will be. Many of our patients, many people in the world have unmet healthcare needs. There are diseases that need to be detected sooner, therapies that could be better, new treatments for cancer, new ways to alleviate pain or suffering, new challenges to help people live healthier lives, new ways to make people more mobile or better able to communicate. There is unfortunately no end to the challenges that we see in healthcare. How can engineering help us solve some of these challenges? And this is an area of engineering that we use to solve these healthcare problems, using new technology, new scientific discoveries to benefit health. And we generally refer to this area of engineering in healthcare as healthcare technology innovation. It's a fast-moving area and very exciting, and I'll present just a couple of examples today. Then that second element is about managing technology, managing equipment in healthcare. Now, the heart of healthcare will always be that personal interaction of people caring for patients. But today, modern healthcare is ever more dependent on technology, on new equipment. Making sure that equipment is in the right place, the right sort of equipment at the right time, and in the right condition to deliver safe and effective care for our patients is the discipline known as health technology management. In terms of the number of people working in healthcare engineering, this is probably the biggest single area. And so I'll spend a bit of time looking at what those people do in health technology management. And then that third area of engineering that we talked about, that area of assessing the impact of technology. This is often referred to as healthcare technology assessment or healthcare technology evaluation. Now we know that technology, that equipment is hugely important in improving people's lives. But we also know that we have limited resources. It doesn't matter whether you're in a rich country or a poor country. The amount of money that you have for providing healthcare is always going to be finite. So you need to be able to decide to evaluate which technology is going to have the best impact, which is better, which is more affordable. How can we manage healthcare improvement for the amount of money that we've got? And this is a large field. It's a health technology assessment. It's a big area. It's a multidisciplinary field to work in, and engineers have a really key role to play here too. Okay, let's look at the first of those areas then, that's health technology innovation. And as I said, there's always going to be challenges that need solutions in healthcare. If you're an engineer that likes solving problems, like working in multidisciplinary groups, if you're creative and prepared to be innovative, and let's face it, that really describes all engineers, then there's no better place to utilize those talents than in healthcare technology innovation. And now I could spend ages that I don't really have this morning looking at the principles of project management and the development of new technology in healthcare. But I thought perhaps the easiest way to give you a flavor for how engineering and technology innovation works in healthcare would be to give you just a couple of examples from my own field. So this is the first example, and it's all about how we look after newborn babies who might unfortunately need resuscitation. A lot of newborn babies actually need some form of resuscitation. And the most important measurement that we need to make on a baby, if it's going to need resuscitation, is its heart rate. How is its heart beating? That's relatively easy to measure the heart rate of a full-term baby, like the one in this picture, and the clinician would simply do that with the stethoscope. But it becomes a bit more challenging if the baby is a tiny, tiny little premature newborn baby. Even with these tiny babies, still, the easiest way to measure their heart rate is using a stethoscope. And that in itself is not a particularly big problem. We can do that. Where it becomes a problem that engineering has been asked to solve, where it becomes a problem is if that little baby suddenly stops breathing. Now, I've worked in healthcare for over 30 years, and I've been in very many difficult, stressful situations, but nothing comes close to the stress in place when a tiny, tiny premature baby like this suddenly stops breathing. There are lots of consultants, lots of nurses that have to get involved to try and resuscitate that baby. But the most important thing we need to do is measure its heart rate. And the only way we could do that is using a stethoscope. And the trouble with that is everybody has to stop. Everybody has to go quiet for 10 seconds or so while the clinician in charge listens to the heart rate with a stethoscope. And during that time, nobody is helping the baby. Nobody is trying to resuscitate the baby. We all have to stop and listen for the heart rate to be counted. So the clinical teams asked us as engineers if we could do something to help them. And of course we could. So what we ended up doing was building quite a simple solution. We started with just a little green light, LED light, and a detector. And we shine that green light into the baby's skin. And as Liz mentioned previously, the light that reflects back out is affected by the pulse of the blood. So we built this little detector into a small medical device, and we attached that detector to the forehead of the baby. And we do have permission to show this baby. She's called Emma, and actually she's about 15 years old now and doing very well with these things. So here we have the little detector attached to the baby's head. The light shines into the baby through the baby's skin. The amount of light that bounces back is dependent on the amount of blood that's flowing, and we can detect the pulse. So we can hear the heart rate detector. And we finally ended up building that into a little woolly hat, because all these premature babies wear little hats to keep them warm. And we used Bluetooth technology so that that detector could talk to a monitor. And so now we have a device which the baby wears all the time in the hospital and is all the time measuring their heart rate. So in the unfortunate case that if this baby did stop breathing, we wouldn't have to stop and listen with a stethoscope to hear what its heart rate was doing. We'd simply have it being measured all the time on that monitor. So that's the first example. It's just simple electronics that engineers put together with a light and a detection. But it's had a major impact on saving babies' lives in resuscitation. A second example that I was going to share with you today, we refer to it as Smart Plus, because that's a funny title. But the problem that we were facing here, the healthcare challenge that we were facing, is in the field of diabetes. And some diabetic patients, unfortunately, they have difficulty with their blood flow to their feet. They have difficulty with the nerves in their feet, so they can't feel their feet very well. And as a result of that, they develop blisters. And the blisters, because they don't heal very well, get worse and they turn into ulcers. And if they're not treated, and they're very, very difficult to treat, if they're not treated, those ulcers just get bigger and they need surgical intervention. And ultimately, many patients actually have to have their feet, or in fact, parts of their legs amputated because these ulcers get so bad. So it's a big problem. So we developed a set of imaging technology using optics to be able to measure the oxygen level across the tissue, across the foot of our diabetic patients. And the image on the right there shows you the saturation of oxygen. How much oxygen is there in the foot? And that tells the clinicians a lot about the ulcer and about how to protect the ulcer and how to treat the patient. And that's great as far as it goes, but it needs a really big camera system of computers, and the patient needs to come into the hospital. What we really want is for our patients not to get the ulcer in the first place. What we really want is to be able to detect that oxygen in their feet all the time, when they're at home, when they're going to school, when they're at work. So we wanted this technology to be built into something the patient could wear all the time. So we got together with a manufacturer of actually elite sportswear who knit fabrics that measure pressure, and we weaved into the fabric fiber optics. So now we have fiber optics in the sock. We could create these fabrics into a sock, and with the sock we could measure the pressure in the foot that the foot was under when a patient is walking, and we can measure the amount of oxygen in their foot while they're walking. And if that oxygen level goes down and it starts to look dangerous, like they might develop a blister or might develop one of these unpleasant ulcers, then an alarm goes off and the patient knows to come into hospital, and we can treat that foot before they get the ulcer. So it saves a huge amount of distress for the patient, and it's much easier to treat their feet before they get those unpleasant ulcers. That's the second example that I was now. And this third example is one of my favourites. We've been working in transport system for a long time in my hospital. We often move patients from one hospital because they need specialist care at a different hospital. And we're a very big hospital that I work in, and we sometimes have to bring patients to our hospitals to receive the specialist care that we can provide that perhaps smaller hospitals can't. And when we move our patients, we generally put them in an ambulance. And an ambulance is just a van, a tin box on wheels, which we then drive across the roads. And it's noisy, and it vibrates, and it rattles, and the patients, and they're very sick patients, get rattled about and exposed to noise and vibration. And some of our most delicate patients are our neonates, again, our babies that are moved from one hospital to another. And when we put them in these, they're actually rattled and shaken about with levels which would be illegal if they were lorry drivers, but we expose our small children to it, our small babies. So we wanted to work out whether some mechanical engineers could design a system which would enable us to move our babies around in these ambulances with all the equipment that they need to keep them alive, but without all that vibration and noise. So we did a lot of modeling, we did a lot of mechanical engineering to work out how we could dampen the systems. We also need to make sure that should the ambulance have a road traffic accident, a crash on the way, whether the babies or the children that we were transporting would be held safe and wouldn't get hurt. And we had to put damping systems them being vibrated. So we worked with a couple of manufacturers to design a new system using our mechanical engineering department. We worked with Land Rover and Jaguar, and we created a brand new system of transporting our babies around. But that was very much a mechanical engineering exercise to do that. So these are three examples of the very, very many from different areas of healthcare where we've brought engineering in to look at a problem that was facing the patients, and then design some engineering solution to improve the way we deliver healthcare. So that's innovation, technology, healthcare technology innovation. So that second area then that I mentioned at the beginning of where we use engineering in healthcare, that second area is health technology management. So that's looking after the equipment we've already got in the hospital, not designing new, but looking after the equipment that we've already got in the hospitals. So it's all well and good to have these wonderful new innovative technologies coming through. Inventing them is just the start. Using them in the healthcare setting, using them to deploy them to keep the patients safe and make sure that the equipment is safe and effective and working correctly, that's the job of healthcare technology management. And as I said, it's possibly the largest area in terms of the number of people that are working in our hospitals in terms of engineering. So healthcare technology management is that discipline of looking after medical equipment in the hospitals. And as I said, it's a huge challenge given the diversity of equipment that we have in healthcare these days. That equipment can range from the relatively simple hospital bed through to some of the most complex and complicated equipment on the planet, like those radiotherapy linear accelerators or MRI scanners that Liz was mentioning earlier. But no matter how big or small the equipment is, no matter how simple or complex that equipment is, you need good engineering processes to make sure they're safe and work effectively. So we have a mantra, a saying in healthcare technology management, and it's all about making sure we have the right equipment in the right place at the right time and in the right condition to deliver good healthcare for our patients. Now, why do we have to go to so much trouble to look after that technology in the hospital or in a healthcare setting? Well, it's really because equipment, medical technology used in healthcare is special, is different. from the way that we have equipment in other walks of life, in domestic roles. And there are three differences that we could say between medical equipment and, if you like, ordinary equipment. And the first clear difference is the function that technology brings. It is often critical, that function, to our patients' well-being. If that equipment were to fail, if that equipment was to work not very well, the result would potentially harm our patients. With domestic equipment, if your television or your cooker at home faulty or stops working well, that would be inconvenient, and you need to do something about it. But if a ventilator on a patient stops working, well, our patient might die within a few minutes. So the function of medical technology is critical, and sets it aside from other technologies that we might use elsewhere. The second difference between equipment used in a hospital and equipment outside of a hospital is that the people it's designed to be used by and for, our patients, tend to be very, very vulnerable. People are only in healthcare because they're poorly. There's something wrong with them. They're not as well as other people. And in fact, some of the people that we see in hospital are some of the most vulnerable people in the whole population. And to make matters worse, we often do things to people in hospitals that make them even more vulnerable. In terms of something that protects us from equipment, protects us from our environment, we've all got skin, and that skin's primary function is to protect us from foreign things outside. But one of the things that we do in hospitals quite often is we penetrate that skin. We stick things inside patients. We open them up in operating theatres. We stick sensors in them, which makes the patient even more vulnerable than they already were. And many times patients are vulnerable in hospitals because we put them to sleep or they're unconscious and they can't respond if something goes wrong. So we have a very vulnerable set of people. So we need to take care of them by making sure we take care of the technology that looks after them. And then the third thing that makes equipment in hospital different to equipment elsewhere is that it is very often part of a system. It's all well and good having one piece of equipment which is safe and effective, but we very often use several bits of equipment on our patients at the same time. This is just a simple example from an intensive care department, and here you can see the bed in the centre there is just one item of equipment. There is also a ventilator, a heart monitor, an observation monitor, an artificial kidney, a dialysis machine, and several infusion devices and infusion pumps. And they all have to work together at the same time, making sure that none of them interfere with any of the others. So again, that's another reason why technology in hospitals is especially different to the way we might manage it outside hospitals. So given that it's different and given that it's so important that we look after this equipment, it's good to have a really good engineering practice to support this equipment. We sometimes talk about having a cradle to grave approach, whereby even before we buy equipment or bring it into our hospitals, we need to assess it, we need to evaluate it, to make sure it's legal, we need to make sure it meets the needs of our patients, and we need to make sure that our clinical staff, our clinical colleagues, know how to use it properly. Once it is delivered into our hospitals, we need to check that it's safe, we need to check that it's working correctly, and we need skilled engineers and technicians that perform both safety and performance checks to make sure that equipment is safe. Once it's in the hospital, once we've checked it and we know it's safe and we've given it to the clinicians so that they can use it on the patients, we need to make sure it stays safe, stays working correctly. So we need to perform routine servicing on that equipment. Equipment fails from time to time, it breaks down. So when that happens, we need to be able to retrieve it from the clinical use. And again, we need a team of skilled technicians and engineers to fault find what's gone wrong with the equipment and try and repair it and put it back into service to continue to offer care to our patients. Eventually, at some point in its life, that equipment will need to be replaced, either because it's broken and it can't be repaired, it's gone beyond what can be repaired, or possibly because new equipment, more modern equipment has come onto the market and the clinical team wants to change the equipment that they're going to use. And again, clinical engineers in healthcare play an important role here in that decision, both deciding whether that equipment can be kept kept working safely, or whether we need to evaluate new equipment to replace it. And so in all these aspects of looking after the equipment, we need engineers and we need technicians to make sure that that equipment is maintained in the right place, the right equipment, at the right time, and in the right condition to be able to offer good healthcare, really good healthcare to our patients. So just briefly then, to come on to the third aspect of engineering that I talked about, this aspect about assessment, about modelling, about being able to forecast and predict what systems and processes do in the real world. And in healthcare, we refer to this as healthcare technology assessment. Now, we know that the demands on healthcare increase all the time, and there are lots of reasons for that. As a population globally, we tend to be getting older, we tend to be getting fatter, more prone to long-term conditions like coronary heart disease or mental health diseases. Life expectancy has risen sharply across the globe, and the demands on healthcare systems have risen even more rapidly. So we need to be able to treat more people and manage more conditions than we were ever asked to before. And this is really good news. You know, as an industry, healthcare has been incredibly successful, but in many ways now, healthcare is becoming a victim of its own success. There are more and more people expecting more and more healthcare, and the costs of meeting this expectation are increasing much faster than the resources we have at our disposal. So what can we do about that? Well, we can use engineering practices to try and assess the value of various healthcare interventions, whether that's technology or anything else. We know then that whether we're in a rich country or a poor country, we'd all of us like more resources and more money to care for our patients. But we have a limited amount of money. So the question is, how do we get the most out of our limited amount of money? We have to decide what to spend our finite resources on. And it can be a really difficult question, both at local level in hospitals, at regional levels in countries, and indeed globally. It's a difficult question to answer. Do we spend our money on chronic conditions like diabetes or coronary heart disease or mental health? Or should we be spending our money on acute care, like treating patients with cancer, or like treating people with injuries and trauma? Should we be spending our money on babies and children who, after all, have their whole life ahead of them? Or should we be concentrating our efforts on older and vulnerable patients? And even when you know when to intervene, what intervention is best? Drug A is an expensive drug, say, much more expensive than drug B, but the manufacturer of drug A claim it's better. Well, is it better? How much better? And how can we measure that if it's better and what the value for money for that drug is? And we have those same challenges with technology. If we create new technology, it might be expensive, but is it better for our patient? And is it sufficiently better for our patient that it's worth the money that we need to spend to develop it? How can we get sustainable healthcare? How can we use technology to provide cheaper healthcare and get more people access to appropriate healthcare? And these are all huge questions and really difficult questions to answer. But in fact, you'll find, although you may not think of this initially as a role that engineers could play, engineers actually have a huge value to play in these questions. Engineers are really good at modeling systems, modeling behaviors of processes, because we are process driven, we're used to the methodologies of measurement, and so we can support health technology assessment and start helping our clinical colleagues and indeed our political colleagues answering the question about what technology should be developed and deployed across our countries, across our hospitals, and indeed internationally. So the world is facing huge pressures on its healthcare system. The coronavirus pandemic has shone a light on the inequalities of healthcare across the planet. And technology is one of the ways that we can develop and help support access to healthcare in countries all around the world. And so this is a key area, I think, for engineers to be involved in because of our ability to model systems and identify which technologies will provide the most cost-effective global interventions. So I apologise, that was a bit of a rush through some aspects of how engineering can be used in healthcare. But what we've seen is that engineering has a huge role to play in just about every single aspect of healthcare, from neonates, from tiny new babies, to our older patients, from chronic conditions to emergency care, in hospitals, in health centres, in fact, in people's homes. Engineering plays a massive role in healthcare. The biggest role in healthcare will always be people, of course. But until recently, the second biggest role, second biggest influence in healthcare has been drugs, has been medication. But now technology has overtaken the role of medication in healthcare, and engineers support that technology. We've seen that there are three main themes, three main areas where engineers support healthcare. The first of those is healthcare technology innovation, looking at the problems, the challenges that people face in healthcare and coming up with engineering and technological solutions to those problems. Then there's healthcare technology management. We've got a lot of equipment, a lot of medical devices, a lot of technology now used in healthcare. Somebody needs to make sure it's the right equipment. Somebody needs to make sure it's working safely and effectively. And that's the role of engineers in healthcare. And then thirdly, perhaps slightly strangely, this whole idea of measuring the impact of interventions in healthcare, healthcare technology assessment, and engineers with our systems approach, our ability to model behaviors, are ideally placed to support the big, difficult decisions about how we use resources in healthcare. So all over the world, engineers are needed to develop new technologies and to implement and manage existing technologies for the next generation of technologies that they're going to be brought into healthcare. So like I say, it was just a touch on some of the things that we do with engineering in healthcare. Over the next few days, you'll see plenty more examples of more detail of how engineers get involved in healthcare. But I hope that's given you just a flavour of some of the things that we do. So thank you very much, and I'm not sure if there's time now for just a few questions on this or on anything else that you've heard this